Welcome, everyone. My name is Elena Cabral, and I'm the Assistant Dean of Academic Programs and Communications at Columbia Journalism School. I'm thrilled to be kicking off the next webinar in the Future of Journalism series hosted by Columbia Global Centers in Santiago with Diego Portales University and the School of Journalism there. As we enter this critical phase of the coronavirus pandemic, we know that health and science reporting is very much front and center, and certainly part of the future of journalism. Caroline Chen, our speaker today, is an award-winning investigative reporter covering healthcare for ProPublica and an adjunct faculty member at Columbia Journalism School. Caroline's 2019 series on heart transplant programs in New Jersey that put metrics over patient care won the Livingston Award for local reporting. And her reporting with a colleague won the June Beeler Cancer Prize for Cancer Journalism in online multimedia reporting. Previously, Caroline worked at Bloomberg News, where she covered the scandalous fall of the blood test maker Theranos and the 2014 Ebola outbreak, among other stories. Caroline graduated from our Stabile investigative program, and this is one of our MS degree programs that has launched many careers at a time when this reporting is needed more than ever. If you'd like to know more about the Stabile program or our data program or any one of our degrees and investigative trainings, please contact me. I put my contact information in the chat. Our moderator, Francisco Aravena, is also a graduate of Columbia Journalism School. He's the editor and director of Crónica Estéreo, the daily news podcast of the Chilean newspaper La Tercera. Francisco is also editor of the supplement Tendencias of the same newspaper, and he conducts science interviews on Radio Duna. His career in journalism includes working for the newspaper El Mercurio and the magazine Que Pasa. He's also an author. His first book, called La Vida Eterna de Phineas Gage, is available on Amazon. With that, I'll turn things over to Francisco to start our discussion.
Hello, everybody. Thank you very much for joining us. First, I wanted to invite everyone who is attending to this virtual event to participate and to suggest questions and to pitch questions. We'll have, after Caroline's presentation, some time to address part of those questions. I imagine that there are a lot of questions related to this topic, particularly today and these weeks. And I wanted to also, if you could indicate whenever you ask a question, a little information about where are you coming from, your background in terms of, in order to help us understand the composition of our audience. That is always very, very useful in order to accommodate the answers to what we think. Particularly Caroline would be grateful to know who is she answering to. So yeah, I guess I just have to pass over to Caroline and to thank you and welcome you, and let's start over.
Yeah, thank you so much. I really appreciate the chance to be speaking with you all here today, and thank you, Elena, for the introduction, and thank you, Francisco, for hosting me today here. So I wanted to maybe start a little bit by telling you a little bit about what I do and what ProPublica is, in case you aren't familiar with where I work. So I'm a healthcare reporter at ProPublica. ProPublica is a nonprofit newsroom based in New York, but we report nationally across the US. And we focus on investigative reporting and accountability journalism. And I think, when the pandemic started, one of the big questions we had was, how do we do investigative reporting during a pandemic? And I think this is a tricky question for many investigative reporters because the pandemic just moves so fast. So at ProPublica, we are used to oftentimes spending months at a time working on a story. The last series that I did the year before, the first story that I worked on took about like five plus months. I have colleagues who have spent a year or even 2 years working on a single story. So I think, I apologize. My cat likes chasing shadows. And so one of the things that we realized early on in the pandemic is that we would have to move faster than usual. But at the same time that we perhaps could have some reporters moving faster and looking forward and having some reporters that were placing bets to look backwards. And so when I first started out, my boss basically asked me, hey, Caroline, can you look at what it is that ProPublica could be doing in this space? Like, we're not a breaking news organization. We're not going to be writing the news. And honestly, where I started was just with a curiosity, which was New York City had started to investigate a couple of people who had been suspected to have the coronavirus, and the city was announcing, we're testing these people. And I would see that announced and I'd be very curious, like, do we have a case yet? So this was in mid-February. And New York City, where I live, is obviously a place where I knew that COVID would eventually hit because of how dense it is and of how many travelers were coming. But I was really surprised that there wasn't an immediate answer within 24 hours as to whether those people were negative or positive. And it turned out, the first few people that were tested in New York were all negative, but it would take about 3 days to get the answer. And because I have some experience as a healthcare reporter previously, and I had helped cover the Ebola outbreak, I knew that if it was taking 3 or 4 days to get the answer, this meant that they were probably sending the samples to the CDC in Atlanta. And I just thought, well, shouldn't New York be able to test locally by now? Especially if we are worried that, this epidemic is going to turn into an epidemic. Should you be able to get answers sooner than waiting 3 or 4 days? So that was just a curiosity I had. And I didn't know. I thought, well, maybe it is normal for it to take this long. So I started to call epidemiologists and public health experts. And I started to say, hey, is this normal? Should New York be able to get an answer within 24 hours? And as I started to ask that question, people started to tell me, yeah, they should be able to get an answer within 24 hours. And the reason why they can is because there are problems with the tests. And that led ProPublica to be able to have a story very early on at the end of February, letting people know that there were problems with the CDC tests. So that was our first entree into reporting and revealing that there were actually problems, was just a curiosity of mine. So I think that that's often a good place to start. And then already at that point, so early on in February, we knew that the CDC had screwed up. And so then we set aside a team of reporters, 3 reporters, to find out what had happened at the CDC. And we knew that that would be a long-term project, like to get people inside the CDC to tell you what had really happened there. Like, we're not going to turn that around really quickly. We're not going to have an answer super fast. So that was what we think of like as a long-term investment. And my bosses said to me, like, we need you to be looking forward and following the pandemic as it evolves. So like, you can't be working on that. So they asked some of our other veteran reporters to be working on that question of like, what happened at the CDC, what went wrong? And that story published in later on, and I do want to pull it up for you because it is just an incredible story. I'm going to let me see if I can put this here. I think I've shared the link. And it's just amazing the amount of details that they were able to get. Like, you get the sense that the reporters are almost like inside the room, and that is really the result of having invested in that investigation there. And I think that was really worth doing. And in the meantime, I and other reporters were doing sort of shorter length investigations. At the same time, we started thinking ahead. Like when I published that first story in February, the next day, like this was near the end of February, the next day we sat down and said, what public records requests can we file immediately? And of course, we wanted to know what was going on at the CDC, but federal level public records requests always take much longer. And so we thought, well, the CDC must be talking to state health departments. So we should FOIA both ends of the conversation. And the state level usually is a lot faster. So we've simultaneously filed FOIA requests asking for conversations about the lab tests to both ends. And that bet paid off, and we were able to get responses back from Nevada. And let me see if I can actually get that story for you as well. Because again, yes, so here's the story that we managed to write end of March. So it did take a little while to get some responses back, but you'll see if you look at this and read it pretty carefully, that you'll notice that we were deriving these from responses from Nevada. And some people were like, why Nevada? And the answer is because Nevada responded to us first. Like, it wasn't like we picked Nevada for some special reason. It's that we sent public records requests pretty much to every state health department, and we got some really good information back from Nevada early. And a lot of other news organizations were like, whoa, how did you get them to respond to you quickly? And it wasn't that we got them to respond to us quickly, it's that we filed these public records requests really early in the game. So I think these were some of the techniques we used to be able to be ahead of the story as much as possible. The other thing I would say is that if you're not a health reporter and you're coming into this game and being like, wow, I'm really out of my depth here, this pandemic has really affected every sector. And so I think some of the most incredible work that my colleagues have done this time has been really playing to their strengths. So for example, Michael Grabel, one of my colleagues, has long done work on industries, including factory workers and areas of labor that have been abused. And so he, that's his ground where he's really comfortable. And so he was like, how is the pandemic affecting, this area? And he already had sources there. So he was able to do a number of really important stories revealing the abuses that were happening inside meatpacking plants. So I think there are many ways that you can think about like what sources you already have and to go there to do hard-hitting stories without having to feel like you're starting it entirely from scratch if you're not already a health reporter. So I feel like I've ranged around a little bit, but I hope that helps give you a sense of what I've done so far and an idea of how it's possible to do investigations, even sort of on a super fast-moving subject, even though I will confess it is a tricky way to, it is a challenge when things are moving so quickly. And then the last thing I will share is just, because I know we're going to probably be talking about this, is our most recent story on vaccines, which is that we were looking at how a lot of states weren't really ready to distribute the Pfizer vaccine to remote areas. And I think one of the ways that I've tried to approach stories is always to think about, who are going to be the people who are left out? Because there are always going to be have and have-nots in society. And I think that what we know about American healthcare is that it's not very equitable. And so when we were looking at the state plans, which again, we got via public record, we started reading through them, and we realized very quickly that people who are in rural areas would probably be left behind. And so having just that mindset of like, who's going to be left out, who's going to be hurt in this area is one way that I've always found useful in looking for stories. So that's where we're continuing to report right now, which is looking at vaccines as they continue to roll out. So I'll stop there. And I know Francisco probably has questions coming up for me.
Yeah, thank you, Caroline. Thank you very much. But first, I wanted to start by asking you. I think this year has been very challenging, even for health and science reporters who are used to cover these topics in a less controversial way. Like you have the experts who always say the truth, and you have the general public who needs to know the truth. And you don't have the narrative of political forces meddling, even though they exist, of course. But in terms of the coding of the information, I think it's been a very challenging year. So I wanted to start by asking you, how do you approach that subtleties when you have, for instance, this narrative of good and bad people? It's very clear that you can state what is a bad position here, or a negligent position in terms of authorities not acting or even denying what's going on, or as we have had here, and I'm sure in almost every country, like the if not manipulation, the convenient showing of numbers in any given moment. But other than that, sometimes you have some subtleties in terms of the good and the bad people. And you have, for instance, you have this notion of the pharma industry, who, I mean, you have there are a lot of problems with that, but they are in some way the good people here. So everything it requires a more complex approach in a subject that particularly now people are very sensitive, and we as communicators are very sensitive of what do people need. Like it's difficult for us as communicators to present of that public role of in some way educating, and so that means in some way to take part or to take sides. I'm sorry, to take sides in terms of of helping quote unquote the authorities to communicate some things in terms of public policy. So I guess I'm sorry, the long introduction,
yeah,
but just to frame it, how have you seen the politics meddling in science and health information in this context in this year?
Yeah, I think this is a great question, and I'm going to try to not give you a novel of an answer, because I really have thought about these dimensions a lot. And I think there isn't one easy answer. I think there is nuance to how we respond to this as reporters. And I do think that it is subtle and that readers can pick up on it over time. So there are some small things that I've done very consciously that I do think that whether or not they're conscious that I'm doing this, readers can tell again over time, which is, so I've tried much more than normal to really date my information and show where it comes from. There's a much higher proportion of links across my stories than there is before, because I just want readers to be able to say, you know, where did I get this? Where did I get this? If they want to see it for themselves, if they want to track it down to the primary documents, they don't need to just believe me on face value. They can go see it themselves. I try to date things to give them a sense that like this information may change, especially when it comes to science. Like a big goal I have as a health and science reporter is to show people the process of science. And I think there's one thing that a lot of people have said accusingly of public health officials. First you tell us to do this, then you tell us to do that, you know, so you were wrong and you lied to us or you had some agenda. And I think that this is the problem with science communication, where science just, like, to me, it's not surprising because I've covered the process of science for so long that I know that, like, as you get more information, you adapt and change. Like, that's not baffling to me, but I have a lot of sympathy for the public that isn't used to this process, that it's going to come across as very strange to them. So I think one thing that I've done is that, you know, in my wording, I say things like, you know, as of now, scientists understand this. They don't understand this. This is what they're doing to try to answer those questions, to give this sense that there is more work to be done. You know, I think even that sort of hints at the process there, you know, and that's part of my interviewing with officials, whether I'm doing it, you know, at a forum in front of people on radio, or whether I'm just doing it in my own interviewing, which will then end up on paper, that I'm going to ask people and challenge them, like, what don't you know right now? Like, what are you still working on? And I think I'm more conscious of trying to address the questions that I know are going to be on readers' minds. It's kind of funny. My dad was kind of teasing me, where he said, you know, in some of the columns I've written, I have this thing where I say, well, maybe you're asking, you have this question on your mind where, you know, whatever it is, and then I answer the question. He's like, I'm not sure that anybody thought of that question. And I'm like, well, look, I'm trying to just step people through things that I know where they might have this sort of, I don't want them to go down this path where they don't know this piece of information, because I know it could lead to some conspiracy theory, right? I think the really tricky space, which I'm not an expert at, is when to address a conspiracy theory and when to not address it. And I think the best advice that I've heard is you don't want to amplify it when it's like at a small level, but when it's sort of like all across social media and hitting headlines, then that's a time that you want to really address it head on. And the advice that I've gotten from our team is always to make sure that your headline, you know, the parts that are going to be shared on social, when a link is shared and there's just, you know, a little snippet of it, that the headline puts the right information, that the headline doesn't have some sort of like question, like, is the earth flat, you know, because that's going to spread the wrong information. So, you know, things that I never thought about, I've learned a lot from our audience team. The one last thing that I just want to add here is, I think a lot about headlines and the way I start my stories. There have been times where my editors have suggested, oh, like last night or the day before, you know, so-and-so politician, whether it's a president or whatever, talked about this thing. And so maybe we should lead with the president, you know, because he just talked about this. And to me, I think it can turn people off because they might start reading and immediately think that it's a political issue or that I have an agenda. So I will I don't want to use a political figure as clickbait unless it is totally germane to my story. Now, of course, if the president is putting out misinformation, I will write a story to combat that. Or maybe lower down in the story, I will address misinformation that's come out from political figures, but I'm not going to use it as a catchy lead or as a hook, because it, you know, just for the sake of being catchy. because I do think that that can make readers think that I have some sort of political agenda. And it's so sensitive right now that I think it makes readers quickly jump to conclusions about what my agenda is.
Yeah.
And my agenda is really bringing forth science and health information. So I prefer to start in less sensitive territory, help you understand that I'm serious. And when you start realizing that I'm serious, that I then maybe say, and by the way, this thing that this political figure said is not actually true. Hopefully you've like hung in with me that long that you might take me seriously then. So at least that's my style. I'm sure there are many ways to do this.
And let me just remind people who are watching this, they can ask questions. There's a chat window. They can ask whatever they want. I wanted to ask you, since you addressed the very tricky subject of conspiracy theories, and is there any thing such as quote unquote dangerous information in a particular timing? For instance, if you come across some information that could, I mean, in your understanding, does not affect the vaccination process or the trust in the vaccine that is going to be inoculated. And of course, in general, we can agree, I guess, in that vaccination is good, and it is a way to keep people safe, right? So you want people to have trust in the vaccine because you understand that it's a trustable, it's okay.
Yeah.
You don't have any information contradicting that, but you come across some information that you know it might play into the hands of anti-vaxxers or people trying to push some particular theory.
Right.
Do you have to make those kind of decisions of what to tell and when in terms of those factors that are surrounding the information right now?
So you're saying if there is factual information,
yeah, like you could say, like, I don't know, like there's some investigation into whether, I don't know, this Pfizer people maybe pushed this a little too far, but there's no information that the vaccine is compromising in that.
Right. I see what you're saying. Yeah. To me, I don't think it is like, if I had that information on hand, I would feel, and it is true and it is verified and I've done my due diligence, I would publish it just because I think it's too far for me to try to read the consequences. I understand your concern, but I think if I didn't publish it, somebody else would probably publish it. And I think that my ability to control the information, put it in the right context, make sure it is 100% factual is far more important. Because again, if I didn't publish it and the information is out there, somebody else could publish it, whether it's another news organization or somebody who is far more sloppy and, casts it in totally the wrong light. Like, for me, I don't write stories where I see them as like, this is a negative story, this is a positive story. To me, it's like, I am writing a story where it's important to tell this information. I think about, is this important for the public to know? And if I've deemed it important for the public to know, then there is some compelling reason to tell it. And I don't think it's for me to sit on news. I also think that it's never, frankly, a good look if later it comes out that I chose to sit on news, So I just don't like to play that game. But I do think it's really important in all cases, of course, to have good context surrounding and a chance, of course, for whoever I'm writing about to respond and to have that all in the story. So again, like, being a responsible journalist and putting out the most responsible version of the news is critical. And then we don't have control over what happens. Like, I have learned as a reporter, like, the internet's going to do what the internet does, and it's like totally unpredictable. And sometimes people get really mad at me over elements of the story that I'm like, see that coming. So I think it's that's beyond our control. Our job is to do the best possible journalism and most responsible journalism with what we have.
And yeah, I was thinking about the it's not the same thing, of course, but I'm thinking about this public narrative, which is not to say it's not true, but you have this established public narrative of who are the heroes here. And the heroes are people on healthcare, healthcare services, right? But of course, we are all human, right? So I was thinking about that story of American Ground by William Langewiesche. When he was reporting on the 9/11 site right after the crash, and so he comes across this. Do you know this story?
No, I don't.
Across this story that was circulating about firemen who were looting the stores right before the towers collapsed, and they supposedly found a fire truck full of things, and no one wanted to report on that because firemen were the heroes of the season, right?
Right.
And he did, Langewiesche, in this long story called American Ground. And he became some kind of a pariah for doing that because he was contradicting the public narrative of who are the good ones and the heroes. And so I think, I mean, how all this is to ask about how do you approach this public narratives of the good ones and the bad ones, and how do you perceive people are going to read or approach your work on that in terms of the ambient of the audience?
Yeah, I love that you raised this question because it's such a good one to remind all journalists that we can't. We've got to like test our own biases and remember that, nobody is, nobody's a saint, nobody's a devil. Like there's no, there are good doctors, there are bad doctors. We know this, I think we've all, if anybody's had encounters with the healthcare system yourself, like you've experienced this. And we've written stories. This is my colleague's story. I will share this in the chat here of Louisiana healthcare system. I think I've maybe shared the follow-up to what happened here, but she basically found a New Orleans healthcare system that had sent some patients home to hospice facilities to die because they were overwhelmed and they didn't have sufficient care, or in many cases they weren't given a choice over whether or not they would go into hospice, which absolutely is the patient's right, and these patients were overwhelmingly Black. So I think it's really important to not buy into those narratives. And I think you can do stories, this is one of those things where like you do stories on both sides of the aisle. Like, I usually think that we're doing a good job when like, if there are two sides to a general debate that like both sides are mad at us, like ProPublica has written plenty of stories about Trump. We've also written stories about Biden's family members. We've written plenty of stories about Hillary Clinton, and that nobody is perfectly satisfied, then I'm like, I'm doing my job. And I think that the same has to apply to doctors and nurses. But again, it has to be the truth. And I think one of the things that is a guiding question for me is when I find an instance of wrongdoing, I ask myself, like, is this, like, what is the degree of harm here? And how widespread is it? What is the scope? if it's a one-off, then you have to have a really compelling reason for me at least, because I can only write so many stories a year, right? If I have a case of a one-off, why am I spending however much time it is writing about one case? Like, so that case has to be, either the harm has to be really huge, or the person that I'm writing about, the doctor or that hospital, has to be a really big name where that writing about that would have a lot of influence. If I'm picking on some like totally random doctor who has not done a very big harm, then it's a bit of like, why are you picking on this guy, right? So I usually look for cases of like widespread harm, or for cases where the person is like the head of their institution, or, you know, known as the head in this field, because so they have widespread influence. And I think that that really helps explain to your readers why they should care. So to me, it should be a case where somebody reads it and they're like, no question, we understand why we should care about this story. And that's what sort of justifies the significance of the story. And so those bars, I think, help you decide when do you write, when do you not write. And in the case of a pandemic, the things that I am often looking for are there sort of systemic harms that people need to be aware of, so that when patients are going through the system, that they know what to look out for. And I think you can write a story where I think a lot of healthcare professionals are under a lot of stress and maybe doing things that are not right, because of that stress. And I think you can show those complicated motives, right? You can say like, this thing that they're doing is wrong. We can agree that that's wrong, but it's coming out of this place where even the healthcare workers are victims. It doesn't excuse what they're doing, but they're under stress. And I think being able to show the gray in that makes it a good story. So again, they're not heroes. They're not devils. Those are the stories that I think are very powerful. I think we have a question.
Yeah, we have a question here. Is from Anna Muto. She asks, given this is a global pandemic, to what extent do you cross-check science information on the virus outside the US and CDC? And how do you prioritize potentially conflicting information on the virus if there are different early stage findings that can shape the direction of your story?
Yeah, thanks so much, Anna. This is a good question. And there are kind of different parts to this. So let's see. A lot of the science studies and data have come from outside the US, and honestly, a lot of them came from outside the US earlier on in the pandemic. So I think a lot of the studies came from Asia, and still continue to come from there, from Italy early on, unfortunately, because they were so hard hit. So I get a lot of information from outside the US. It depends on the story. So if I'm writing a story about the virus, so I think about it like this. If I'm writing a story about the virus and about how the virus moves, transmits, behaves, it doesn't really matter where the information comes from. If I'm writing a story about the consequences in the US, I do have to be aware that there's some regional aspects to it. And even within the US, Wyoming is not New York City. So I have to be careful not to apply the findings of a study in Wyoming to say that this is how it's going to act in New York City because of regional differences. So that's just an awareness that I have to have in terms of not applying one finding to a different place. But this is all, the amount of global research that has been produced is amazing. And I definitely have depended on global research to inform what I've been able to do. In terms of how do I prioritize potentially conflicting information, one, if it's very conflicting, I don't report on it, because I think, well, if I interview, well, one, I'm not an epidemiologist or a virologist myself, so I'll read all the studies out there and then I'll start calling scientists. And if the answer is a whole slurry, that's not ready to present to the public, I might not write about it yet. But if it's something where it's like, this is a hot pressing topic, everybody wants to know the answer. So early on, is there transmission in kids? I think we did do a breakdown, which is like, here is what we know right now. Here are the answers that are easy. There's a clear answer. So there's like, I was able to say, we have a clear answer right now on how severe it is in kids. And here are the studies that back that up. And the answer was, by and large, kids do not get that sick. And there was a lot of material behind that. And then I was able to say, there is not great information yet on whether or not kids transmit. I mean, now we have better information, but back when I was writing that story, which was April, there was not. And I was able to say, look, here are some studies on this side. Here are studies that seem to show the exact opposite thing. And being able to, I think, just provide a couple of links on either side and be very transparent that they seem to show opposite things, and then quote some experts saying, we need to do more work to answer this question, I think was helpful for our readers because, again, going back to Francisco's question right at the beginning, in the politicized environment, a lot of people were just seeing people waving one study around to support their side. So I think it was useful for our readers to be able to show them, actually, there are studies that show both sides. And so we cannot yet answer this question. So I think sometimes it can be useful to readers to actually just present them what's available. There's another question in the chat right now.
Yeah, let me check.
Not in the Q&A.
I'm not. Oh, okay.
Yeah.
The chat.
Which is, how do you recommend to do field reporting during a pandemic? Which is, journalists are usually not allowed in hospitals. So I've had a lot of discussions about this in our newsroom, and I want to start by saying that there's no one size fits all answer to this, and it really depends on you. It depends on where you are. And what do I mean by that? Like, I mean, it depends on your health profile. So like, you might be very healthy. You might not be. Like, you might have underlying health conditions. You might live with somebody who's very high risk. Like, so I think it has to start with who you are and what your risk tolerance is, and everybody's risk tolerance is different. So our standard at ProPublica is that if anybody wants to go report in the field, it has to be initiated by the journalist and it cannot be ordered by the editor. So the journalist has to say, I want to go into the field, and then it has to be discussed with the editor, and then they have to agree that it is necessary for the story. But the editor cannot say, I'm ordering you to go into the field. So that's number one. Number two, when I say it depends on where you are, by that I mean infection rates will determine a lot of what is safe or not safe. So I felt safe doing some things in New York during the summer when infection rates were very low that I do not feel safe doing now. So that's also going to change your answer. I know that's very annoying that I'm giving so many caveats ahead, but I think that's really, really important. So after I answer that, I think the big rules of thumbs I have are, and we have had reporters who have gone on planes and done reporting. Again, it's been very individual, very situational. I have not gotten on a plane, again, for personal reasons. I don't feel safe getting on a plane, but I have gone to meet sources in New York where we meet outdoors. I would say always seek open air as much as possible. You might say, oh, I need to go look inside a hospital or a homeless shelter, or whatever it is, for color. That's fine, but you don't have to do the full hour-long interview inside, right? Even if you are going in a hospital to get color, you can go inside, take a couple photos, and then do the interview outside. Like, so maximize open air. I am not very good. So this is my personal way of remembering. I'm not very good at remembering to like sanitize things constantly. So I like to think only the soles of my shoes touch the floor and nothing else touches anything else. So I try to like keep my bag on my shoulder, and I try to just like not put it down, put my notebook on the table, put my phone on a counter, whatever. I just try to keep everything on me and think like just my shoes touch the floor, nothing else touches anything else, and then sanitize my hands if they, touch things. But, it's easier for me to think that way. Other people have other systems. And then the last thing I think about is like, we should have similar levels of PPE to the people around us. So if you are in a hospital situation, let's say a hospital has allowed you to come in, you've negotiated that to see something, like you should have the same level of equipment that the people in the room you have. And if you don't have that and you're not equipped for that, you should not be in that room. Like if your newsroom cannot provide it or the hospital cannot provide it, forget it. Like, so that's my general rule of thumb. Like if I cannot be equipped to the same level that the people around me are equipped, I should not be reporting there. But I think we have been able to be very creative about doing reporting remotely during this time. And I found that I've managed to do almost all my reporting from my desk. I mean, it's driving me nuts because I really like to go visit people in person, but I've made a lot of relationships with hospital workers where I actually find that like I have sort of casual texting relationships with them. So I'll text them and just be like, hey, how's it going? They know they already trust me because I've done one story with them. I'm not gonna name them. And they'll just be like, oh, it's fine. But they know that I'm in their phone, and then they'll get really frustrated one day and they'll call me or they'll text me and they'll be like, you can't believe this like email we got today. And then I'll be like, oh, can you share it with me? And because people are so facile on their phones, they'll just take a screenshot and they'll send it to me. Or they'll be like, they'll take a photo of a thing and they'll send it to me. Sometimes when I'm interviewing people at home, I'll be like, I know this sounds really awkward, but I like to imagine where people are. Or they'll be like, oh, they'll mention, and I'll be like, so can you take a picture of your living room? And they're like, you don't want to see my living room. My living room is a mess. I'm like, my living room is a mess too, but I just like want to imagine where you are. And they'll just take a picture of their living room and they'll send it to me. So I'll get this sort of color. Yeah. People are so used to Zoom now. I'll be like, can we do a Zoom call instead of a, and I'll pick up color that way, that I couldn't do just over the phone. So there's so many ways I think that you can get creative about remote reporting. It's not as great as hanging out with people in person, but you can, I think, find substitutes. Mm-hmm. So
I wanted to ask you about a big player on all this story, particularly right now, which is the pharmaceutical industry. Mm-hmm. And we have seen this tremendous competition and race to get the vaccine. And the other day I was talking with a scientist who is specialized in these things, and he introduced me to the concept of co-petition, which is cooperation and competition. He pointed that the scientists were all cooperating, and then the people in the industry were competing. So it's a very unique setting for. I mean, it's different than any other industry, particularly in this emergency. But nevertheless, we are talking about big financial interests too. Mm-hmm. We are talking about information that even for a day can bump the stocks of a company and make some people that we don't know and we won't ever know earn like millions of dollars based on whatever everybody's just repeating that day. So I guess in a way this year has shown us what it's all about all the time, but comprised in a very short period of time. But at the same time, I wanted to ask you, what should we learn about the dynamics of this industry that has so ingrained the financial interests, the politics and the science, and in that regard, the general well-being of the world population. I mean, it's a very tricky thing to cover, having all these components, right?
Yeah, I mean, the pharma industry is so interesting, and I think one of the things, I mean, you've covered so many things there. I think one of the things that maybe is remarkable to me is how much a difference tons of money and attention makes to advancing science. So
Sure.
the vaccines that are being approved right now, Pfizer's and Moderna's, are a technology called mRNA. And I'm sure a lot of people on this call have heard about it and read about it. They're the first mRNA vaccines to be approved. And this technology has been worked on for more than a decade. And Moderna, this is their first vaccine to be approved and on the market. And it is remarkable to me that, this startup has been working for years and trying to get a product on the market. And this pandemic has totally changed the story for this company, because they got an infusion of money from the government. These trials that normally take years and years basically got an accelerated timeline. They're on the cusp of approval of a vaccine that has had extraordinarily good results. And it's just it really makes me think, if we had this sort of attention and money and focus on some of these other diseases, what could we do? Obviously that's probably not practically feasible, but it's a remarkable story of how many years of toil have gone really, really slowly. I've covered Moderna cancer vaccine, which is still hanging out in trials right now.
Yeah.
Goodness knows how many years it's going to take before it comes to market. And if not for the pandemic, it would probably be another 5 years that they would have their first product approved, because that's the pace of science when you don't have a pandemic and funding from across the globe. So I do think that this is remarkable, but it kind of shows you what's needed to really grease the wheels, and how hard it is to run a trial of scale. I think the other thing that I think about a lot is just the fact that this is such a rare opportunity. So vaccines normally are not a place where pharma puts a lot of attention on, because it doesn't make a lot of money compared to cancer drugs, compared to rare disease drugs. So the fact that we are going to have multiple different companies all making the same vaccine is a pretty remarkable and different different moment in time that we just haven't seen before. And again, I don't know if the public realizes how special this is, that the fact that we have something like 5 or 6 companies in phase 3 trials right now, all making a vaccine for the same disease. We just haven't seen this before.
Yeah. I'm sure that I'm hoping that we are all, as a society, including, of course, the media, will emerge from this, hopefully a little more savvy about all these things that are going on, in despite of the attention, being put elsewhere. Caroline, thank you very much. I have to get this thing over. This is I don't know if I have, please Elena or Fran or whoever, if they want to interject here, because I don't know if you want to say something to close this activity, but I've been asked to indicate that this is the last activity of the year of this cycle called The Future of Journalism, organized by the Columbia J School, Columbia Global Centers Santiago, and Periodismo UDP. So if no one else is, oh, Elena, how are you?
Hey, yes, no, that was a fascinating talk. We probably could go on for longer. But the good news is that, particularly where we are today in the news cycle, I encourage everyone to follow Caroline's work and to share it broadly, because as I alluded to earlier, she is really one of the most authoritative voices in my book on what is happening in the U.S., which of course reverberates around the world. And as you can see and have heard today, and her careful reporting is something that is essential reading. So thank you, Caroline. I know you have a very busy day today, and we appreciate the time that you've given us.
Thanks so much for inviting me. This was a pleasure.
Thank you, everyone. Take care.
Okay, bye.
Thank you. Goodbye.